Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm so glad that you've all been able to join us here today. I have a very special guest that I'm introducing to you here today, Dr. Amy Fung. Welcome, Amy. It's so good to have you here today.
Hi, Fiona.
We're going to be talking about, of course, your presentation coming up at our Gold Tongue Tie Symposium, Finding Balance in Tongue Tie Treatment, which I know is a big topic, but we'll get into some details in just a moment. So, Dr. Amy is going to be with us for our Tongue Tie Symposium, which is coming up here at Gold Learning. You can check out all the details at goldtonguetie.com. So we'll look forward to seeing, of course, many of you there. You can head over to the website right now, check out all the details, and of course, learn a little bit more about Amy's presentation. So please welcome everyone, Dr. Amy Fung. So Amy, go ahead and share a little bit about yourself. Tell people where you are in the world. And then, of course, I know that you have a book that you're going to share with us here today. So tell everybody a little bit about yourself.
Yeah, hi everyone all over the world. I come from a little city, Hong Kong. Yeah, in Hong Kong, I was a breastfed mother of 3 children actually, and they are in the university. And yeah, I am a GP and IBCLC, and some Hong Kong people tell me, "Oh, you are breastfeeding doctor." Yeah, in Chinese is yeah 母语医生. Okay, and so I'm so happy to have my breastfeeding experience by myself, and then I share the knowledge and the skills and also everything with my clients. And I'm so glad that I wrote a book
Mm.
in Chinese. Okay, in Chinese the name is it easy to breastfeed? Okay.
Oh, yeah.
Yeah. So it is a question. Okay, I try to make it breastfeeding, make it easier. Yeah.
Right.
Yeah, because it is a very experience, a very precious experience for myself.
Mm.
And so I'm so happy to share everything with my friends and colleagues and also my clients. Yeah.
Yeah, that's wonderful. And what a great you just noted I just heard you say there and made a mental note of it that you said it's a very precious experience. And I think those words are very poignant. I don't think I've ever heard it described that way before, which is just beautiful. But it is for so many people, it becomes such an incredible experience. So thank you for sharing that and your book too, to support so many mothers around the world. So tell me a little bit. So we'll talk a little bit about the topic now, and get into your presentation just a little bit, so people can understand and learn a little bit about what to expect, on the day. Now, tongue tie treatment in breastfed infants, babies, can be quite controversial. We've heard a lot of conversation about, you know, how often it's happening. I know you're going to be sharing a little bit about this too. But why is it so important for healthcare providers to find that balance in how we recognize it and how we support tongue tie? Tell me a little bit about that.
Yeah, I think finding a balance is so important for everything, including tongue tie, because tongue tie is such a controversy. Yeah, I believe it will keep on a controversy actually. Yeah, because a lot of gray area in medicine. Yeah,
Right.
including tongue tie. And one thing is tongue tie is not just an anatomical diagnosis. Yeah, it is a functional diagnosis. And we should involve the mother and the baby as well. So if we don't find a balance, that means that we'll go for two extremes. You know,
Right.
one extreme is going to never do frenotomy at all.
Hmm.
Yeah. Another extreme is do frenotomy for all babies with heart-shaped tongue or with impaired or restrictive lingual frenulum. So we need to find a balance, yeah, in the middle, so that and also we as a healthcare professional, we need to have knowledge and skill, yeah, to have a comprehensive approach.
Mm. Yeah, absolutely. And I love thinking about that whole, finding balance. I think it's challenging. I think the more we talk about it and the more we share experience as
Yeah.
professionals helps
Mm.
for sure. So in your presentation, in your talk, you'll be helping us sort of understand a little bit better about the anatomy, of the lingual phylum. Can you share why this is so important piece for clinicians, just understanding the anatomical factors?
Yeah, it's so important since my medical student year, anatomy, starting from year one. It's so boring, right? Okay, but yeah, in the past 1 to 2 years, I just learned a lot of anatomy from tongue, yeah,
Mm,
lingual frenulum, and it widened my exposure actually. So
mm,
I think two issues I learned from it, and it has a lot of clinical implications. First is the muscle, and
mhm.
second is the nerve, because we just they conclude that lingual frenulum is not just submucosal band.
Right.
Okay, no vessel, no nerve, no muscle. Yeah, no life. Okay, it's a static thing. But actually, after this anatomical finding, it is a dynamic issue. It is it is a lively thing. Okay, yeah. What's lively is because underneath the fascia, underneath the mucosa, underneath the fascia, actually there's some muscle fiber. Yeah, in the lingual frenulum. So, do you go to gym? Okay, strengthen up the muscle. Yeah, muscle can be trained. You know, because in the lingual frenulum, actually there is some genius causes muscle fiber. So there's chance we can train up the muscle.
Mm,
Yeah, to train up the tongue so that maybe some baby doesn't need the frenotomy, and after take some time and training, okay, in feeding, so maybe improve. And the second thing is the nerve. Yeah,
mm.
we used to believe that only the larger branch of the lingual nerve on the lateral side. And so I always talk to the patients that, oh, no, very low risk to cut the
Right.
the nerve. Okay. But in the study, it shows that actually there are some smaller branches of the lingual nerve crossing the midline. And so that there might be potential nerve injury.
Mm. That is fascinating. That is so interesting. I think that this is an area that is, underdeveloped and lacking in
Yeah.
knowledge, for a lot of
Mm,
practitioners. And I think
mm,
anybody who
mm,
has contact with families in this area who is either, looking, helping, supporting, whatever your role as a
mm,
healthcare professional is, this is an area that we really need more knowledge in. Would you not
mm,
agree,
mm.
Amy? Right?
Yeah. And actually, this is another dilemma of tongue-tie practitioner. Because the nerve injury, the risk maybe
Right.
depends on how deep you cut it.
Right.
Yeah. Yeah. So as a practitioner, we need to make a decision. Yeah, how
Mm.
deep we need to cut, or what method we use it in
Sure.
phenotomy. Yeah, it maybe make some difference.
Yeah, absolutely. Yeah, this is gonna be an area I think is really going to open up, and I
Yeah.
think that, we'll have to, definitely look at more of the research, but also just the practice, of how we're,
Mm.
managing it. So I can't wait to learn more from you about this area. Yeah. So, just looking at your presentation
Mm.
again, because I know it's going to be so exciting. I know you're going to be
Mm.
here with us live, on our tongue tie symposium. And so everybody listening in will actually be able to come and listen. But not only that, we'll be able to have a chance to sit down and
Mm.
discuss more of
Yeah.
these things in detail. But as your presentation looks at sort of that comprehensive approach,
Mm. Yeah.
caring for babies and families, what sort of things can the attendees expect to take away that will help them directly in their practice?
Yeah, I think first of all, we don't just look at the baby's mouth, okay,
Mm,
or the tongue. We
right.
need to, yeah, apart from the tongue, we need to take care of the mother, because the
Right.
mother and baby diet is interactive, all the way during the breastfeeding, so that we need to assess the mother's any other coexisting problem, for
Right.
example, milk supply issue or any pain. Yeah. And so we will step by step, taking history, examine the baby and the mother, and observe the baby's breastfeeding condition, and then make a conclusion. See whether it is really a symptomatic tongue tie. Yeah,
Mm,
we call this symptomatic if there's some breastfeeding problem. Yeah, together
yeah.
with restrictive lingual frenulum.
Yeah, no, that's absolutely amazing. I think, yeah, we've come to learn that we're in this whole big dynamic, of
Mm-mm-mm.
understanding both the infant and the mother, and sometimes the entire family, just
Yeah, yeah,
to
right.
to support them on their journey as well. Yeah. Well, Amy, thank you so much for being, here with us today. I'm very excited for your presentation. And of course, once again, for everybody listening in, finding balance in tongue tie treatment is what you're going to be sharing about, which is going to be fabulous. You can head over to the website to goldtonguetie.com to check out all the details of this upcoming presentation and, of course, all the presentations that be with us. Thank you again to Dr. Amy Fung for being with us here today.
Yeah.
It's been lovely chatting with you. Thank you so much. We'll look forward to seeing everybody on our live event. Thank you again for joining us here today. Have a wonderful rest of your day, everyone. Bye bye for now.
Okay, bye.